Question 1. A child care provider notices a 2-year-old child consistently avoids eye contact, does not respond to their name, and engages in repetitive rocking. Which of the following actions is most appropriate for the provider to take first? A. Inform the parents immediately about their concerns and suggest they seek a professional evaluation. B. Implement a new behavior chart to encourage more social interaction. C. Document the observations for a week before speaking with the parents. D. Provide the child with more one-on-one attention to encourage communication. Answer: A. Inform the parents immediately about their concerns and suggest they seek a professional evaluation. This question tests a provider's understanding of early intervention for developmental concerns, focusing on the keywords consistently avoids eye contact, does not respond, and repetitive rocking in a 2-year-old, which are potential red flags. The most appropriate first action is always to communicate with the family, as they are the primary decision-makers for their child's health and development, and a professional evaluation is crucial for identifying any underlying needs. For instance, documenting observations is important, but delaying communication with parents when concerns arise can delay crucial support for the child. Prompt and respectful communication ensures families can access necessary resources and early intervention services. Remember, family partnership and early intervention are key when developmental delays are suspected. Question 2. When planning an indoor environment for toddlers, which of the following is the most critical consideration for promoting development? A. Providing a wide variety of electronic learning devices. B. Ensuring plenty of open space for gross motor activities. C. Organizing distinct interest areas with age-appropriate materials. D. Decorating with bright, stimulating colors and elaborate murals. Answer: C. Organizing distinct interest areas with age-appropriate materials. This question addresses the effective design of a learning environment for toddlers, emphasizing promoting development. While open space and stimulating colors are beneficial, the most critical element for holistic development is creating clearly defined interest areas, like a cozy reading nook, a block area, or a dramatic play corner, filled with materials that are safe, accessible, and suitable for the toddler's age and developmental stage. This organization helps children explore different types of play, encourages independent choices, and reduces overstimulation. For example, a well-defined art area with chunky crayons and large paper invites creativity without requiring constant direct supervision. A well-organized environment encourages engagement and supports learning through play. Question 3. A 4-year-old child consistently struggles with sharing toys and often snatches items from peers. What is the most effective positive guidance strategy for the provider to use in this situation? A. Implement a timeout every time the child snatches a toy. B. Verbally scold the child immediately after the behavior occurs. C. Offer clear instructions and facilitate turn-taking opportunities with adult support. D. Remove the child from group play for the rest of the day. Answer: C. Offer clear instructions and facilitate turn-taking opportunities with adult support. This question focuses on appropriate positive guidance techniques for managing challenging social behaviors like not sharing or snatching, with the keyword most effective. While other options are forms of consequence, positive guidance emphasizes teaching and supporting children to learn pro-social behaviors. Providing clear, simple instructions on how to share, when you're done, offer it to your friend, and actively guiding children through the process of turn-taking helps them practice and internalize the desired behavior. For example, a provider might say, "It looks like Maria is using that truck right now. When she's finished, you can have a turn. Let's find another truck for you while you wait." This approach teaches the skill directly rather than just punishing the misbehavior. Remember, positive guidance is about teaching what to do, not just what not to do. Question 4. What is the primary purpose of daily health checks in a child care setting? A. To identify children who might need medical attention and prevent the spread of illness. B. To document each child's growth and developmental milestones. C. To assess the overall cleanliness of the facility and equipment. D. To determine if children have brought forbidden items into the program. Answer: A. To identify children who might need medical attention and prevent the spread of illness. This question tests understanding of essential health and safety practices, specifically the primary purpose of daily health checks. Daily health checks involve a quick visual scan and brief interaction with each child upon arrival to look for signs of illness, e.g., rash, fever, lethargy, or injury. This proactive measure is crucial for protecting the health of all children and staff by identifying contagious conditions early and ensuring that sick children do not expose others. For instance, spotting a child with a new rash allows a provider to take immediate steps like isolating the child and contacting parents, preventing a potential outbreak. Regular health checks are a cornerstone of maintaining a healthy and safe environment for everyone. Question 5. A CDA professional is observing a 3-year-old child stacking blocks repeatedly, occasionally knocking them down and rebuilding. According to Piaget's stages of cognitive development, this play is characteristic of which stage? A. Sensoromotor stage. B. Pre-operational stage. C. Concrete operational stage. D. Formal operational stage. Answer: B. Pre-operational stage. This question tests knowledge of Piaget's theory of cognitive development, specifically focusing on a 3-year-old's play, which involves symbolic thought and early problem-solving. The pre-operational stage, typically from ages 2 to 7, is characterized by children beginning to use symbols, like words and images, to represent objects and ideas, engaging in imaginative play, and developing logical reasoning, although it's still largely intuitive and egocentric. Stacking blocks and rebuilding them demonstrates developing symbolic thought and exploration of cause and effect, fitting perfectly into this stage. For example, a child might pretend the blocks are a castle or a tall tower for a toy figure, which is a key aspect of pre-operational play. Understanding these stages helps providers tailor activities to children's cognitive abilities. Question 6. When communicating with families about their child's challenging behavior, what is the most effective approach for a CDA professional? A. Focus solely on the negative behaviors and recommend immediate professional therapy. B. Present observations objectively, describe specific behaviors, and focus on collaborative solutions. C. Wait until the behavior escalates significantly before contacting the family. D. Assign blame to the family for the child's behavior and demand changes at home. Answer: B. Present observations objectively, describe specific behaviors, and focus on collaborative solutions. This question assesses effective communication strategies with families, particularly regarding sensitive topics like challenging behavior, with the keyword most effective. An objective and collaborative approach builds trust and partnership. Instead of making judgments or blaming, a CDA professional should share factual observations. I noticed Sarah hit another child twice during free play today, and invite families to work together on strategies that can be consistent between home and the program. For example, rather than saying your child is aggressive, a provider might say, we've observed Sarah struggling to share toys, which sometimes leads to her hitting. How do you handle this at home, and what can we try together here? This approach respects families and fosters shared responsibility for the child's well-being. Question 7. What is the primary reason for conducting ongoing observations and assessments in a child care program? A. To assign grades to children for their academic performance. B. To compare children's development against national averages. C. To tailor the curriculum and activities to meet individual children's needs and support their development. D. To determine which children are ready for kindergarten at an early age. Answer: C. To tailor the curriculum and activities to meet individual children's needs and support their development. This question tests the understanding of the purpose of observation and assessment in early childhood education, specifically highlighting primary reason and ongoing. Observations and assessments are not for grading or comparison, but rather a continuous process of gathering information about what children know, can do, and are interested in. This data helps providers understand each child's unique developmental trajectory, allowing them to individualize learning experiences, adapt the environment, and plan activities that genuinely support each child's growth and learning. For example, if observations show a child is fascinated by insects, the provider might introduce books about bugs or magnifiers to encourage further exploration. Regular observations inform responsive teaching and program planning. Question 8. A child care provider notices a child is showing signs of neglect, such as being consistently unkempt, hungry, and withdrawn. What is the provider's ethical and legal responsibility in this situation? A. Privately confront the parents and demand they improve the child's care. B. Document the observations for an extended period before taking any action. C. Report the suspected neglect to the appropriate Child Protective Services agency. D. Offer extra food and clothing to the child discreetly without involving outside authorities. Answer: C. Report the suspected neglect to the appropriate Child Protective Services agency. This question addresses the critical responsibility of mandated reporting in child care, focusing on ethical and legal responsibility when signs of neglect are present. Early childhood professionals are legally mandated reporters, meaning they are required by law to report suspected child abuse or neglect to Child Protective Services, CPS, or the designated agency in their state. It is not the provider's role to investigate or confront parents, but rather to report concerns so that trained professionals can assess the situation. For instance, if a child consistently arrives in dirty clothes, appears hungry, and talks about being left alone for long periods, the provider must contact CPS, providing objective observations. Protecting children from harm is paramount, and mandated reporting is a non-negotiable duty. Question 9. Which of the following is the most effective way to prevent the spread of germs in a child care environment? A. Regularly sanitizing toys and surfaces throughout the day. B. Encouraging children to cough into their hands. C. Relying solely on hand sanitizer instead of hand washing. D. Allowing sick children to attend as long as they don't have a fever. Answer: A. Regularly sanitizing toys and surfaces throughout the day. This question focuses on essential health practices in child care, specifically prevent the spread of germs, which is a core safety concern. While hand washing is crucial, regular sanitizing of high-touch surfaces and toys is equally vital because germs can live on surfaces for hours or even days and be transferred through touch. Implementing a routine where toys are cleaned after use, especially those mouthed by infants and toddlers, significantly reduces the transmission of bacteria and viruses. For example, rotating toys so that one set is being cleaned while another is in use ensures a continuous supply of hygienic play materials. Consistent environmental sanitation complements good personal hygiene to create a healthier setting. Question 10. A Child Development Associate, CDA, is planning a new activity for a group of 4-year-olds. According to best practices, which of the following is most important to consider when selecting materials for the activity? A. Materials that are expensive and brand new to impress parents. B. Materials that promote only fine motor skill development. C. Materials that are open-ended, age-appropriate, and allow for multiple uses. D. Materials that require minimal adult supervision and guidance. Answer: C. materials that are open-ended, age-appropriate, and allow for multiple uses. This question explores effective curriculum planning and material selection for preschoolers, with most important indicating a need for a comprehensive understanding. Open-ended materials, like blocks, Play-Doh, or natural items, encourage creativity, problem-solving, and a variety of play scenarios because children can use them in many different ways rather than being limited to one specific function. Such materials support diverse developmental areas, cognitive, social, emotional, and physical, and can be adapted to individual interests and skill levels. For example, a set of wooden blocks can become a castle, a car, or a bridge, fostering imaginative play and engineering skills. Choosing versatile and age-appropriate materials supports deeper engagement and learning. Question 11. What is the primary benefit of encouraging children to engage in dramatic play? A. It primarily develops fine motor skills through manipulation of props. B. It helps children understand and practice social roles, language, and emotional expression. C. It is mainly a way for children to unwind and relax after academic activities. D. It improves mathematical reasoning through counting and sorting props. Answer: B. It helps children understand and practice social roles, language, and emotional expression. This question focuses on the developmental benefits of dramatic play, highlighting its primary benefit. Dramatic play, also known as pretend play, is incredibly valuable because it allows children to explore different social roles, practice communication skills, negotiate with peers, and express a range of emotions in a safe, imaginative context. It's a key avenue for social-emotional development and language acquisition. For example, when children pretend to be doctors and patients, they learn about helping others, using new vocabulary, and expressing empathy. Encouraging dramatic play supports critical social and emotional learning in a fun and engaging way. Question 12. A child care provider is preparing to lead a group discussion with 5-year-olds about resolving a conflict. What is the most effective strategy for the provider to use to facilitate this discussion? A. Tell the children exactly how to solve the problem and move on. B. Assign blame to one child and praise the other for being good. C. Listen actively to each child's perspective and guide them to brainstorm solutions together. D. Ignore the conflict and hope the children resolve it on their own without intervention. Answer: C. Listen actively to each child's perspective and guide them to brainstorm solutions together. This question addresses conflict resolution strategies for preschoolers, emphasizing the most effective strategy. Effective conflict resolution involves teaching children how to problem solve and communicate respectfully, rather than dictating solutions or assigning blame. By listening to each child's point of view, the provider validates their feelings and helps them understand the other's perspective, then empowers them to think of fair solutions together. For example, if 2 children are fighting over a toy, the provider might say, "It looks like both of you want the truck. How can we figure out a way for both of you to have a turn?" This approach teaches valuable social and problem-solving skills that children can use in future situations. Question 13. Which of the following best describes the purpose of a transition in a child care schedule? A. To allow children to engage in free play without adult supervision. B. To move children smoothly and purposefully from one activity or area to another. C. To provide a mandatory nap time for all children regardless of age. D. To give teachers a break from direct interaction with children. Answer: B. To move children smoothly and purposefully from one activity or area to another. This question addresses program management and scheduling, specifically the purpose of transitions. Transitions are planned moments in the daily schedule designed to help children shift from one activity or location to the next in an organized and calm manner. Effective transitions minimize chaos, reduce behavioral challenges, and maximize learning time by keeping children engaged and prepared for what's next. For example, singing a cleanup song before moving from playtime to snack time helps children understand the expectation and transition smoothly. Well-managed transitions are essential for a positive and productive learning environment. Question 14. What is the primary reason for a child care program to maintain accurate and confidential records for each child? A. To share personal information with any interested party upon request. B. To track potential behavioral issues for disciplinary action. C. To ensure safety, support individual development, and facilitate communication with families and professionals. D. To justify tuition increases and program expenses to parents. Answer: C. To ensure safety, support individual development, and facilitate communication with families and professionals. This question addresses the importance of record keeping in child care, focusing on the primary reason and keywords accurate and confidential. Maintaining thorough and confidential records, such as emergency contacts, health information, developmental observations, and incident reports, is crucial for several reasons. These records ensure that providers can respond quickly in emergencies, track a child's progress to tailor their learning experiences, and communicate effectively with parents or other professionals when necessary, all while protecting privacy. For example, knowing a child's allergy information from their record is vital in an emergency. Proper record keeping is a fundamental aspect of professional and responsible child care. Question 15. A 5-year-old child consistently refuses to participate in group activities, preferring to play alone. What is the most appropriate action for the provider to take? A. Force the child to join the group activities immediately to overcome shyness. B. Ignore the child's preference and allow them to play alone indefinitely. C. Observe the child's interests and gradually encourage participation in small, inviting group settings. D. Tell the child that playing alone is not allowed in the classroom. Answer: C. Observe the child's interests and gradually encourage participation in small, inviting group settings. This question addresses supporting a child's social-emotional development, specifically shyness or a preference for solitary play, with most appropriate action. It's important to respect a child's individual temperament while gently encouraging social engagement. Observing the child's interests can provide clues on how to make group activities more appealing or how to facilitate interactions with just one or two other children first. For example, if the child loves dinosaurs, the provider might invite them to join a small group building a dinosaur habitat with blocks, offering support and encouragement without pressure. Gradual, supportive integration helps children feel safe and successful in social settings. Question 16. What is the ethical responsibility of a CDA professional regarding the confidentiality of information about children and families? A. To share information freely with other professionals outside the program for networking. B. To discuss family matters with personal friends and acquaintances. C. To maintain strict confidentiality, sharing information only with authorized individuals on a need-to-know basis. D. To post positive anecdotes about children on social media without identifying them. Answer: C. To maintain strict confidentiality, sharing information only with authorized individuals on a need-to-know basis. This question highlights a fundamental ethical standard for CDA professionals: confidentiality. Protecting sensitive information about children and their families is a non-negotiable professional responsibility. This means only sharing information with those directly involved in the child's care and education who have a legitimate need to know, and only with parental consent when required. For example, a provider would share a child's allergy information with a substitute teacher but would not discuss a family's financial struggles with another parent. Upholding confidentiality builds trust with families and respects their privacy. Question 17. When planning a daily menu for preschoolers, which of the following is the most important consideration? A. Offering only foods that all children consistently enjoy. B. Providing highly processed snacks that are easy to prepare. C. Ensuring a variety of nutrient-dense foods from all food groups. D. Focusing primarily on high-sugar treats to encourage consumption. Answer: C. Ensuring a variety of nutrient-dense foods from all food groups. This question addresses healthy nutrition practices in child care, emphasizing the most important consideration for daily menus. A balanced diet is crucial for children's growth, development, and energy levels throughout the day. Providers should plan meals and snacks that include a wide range of fruits, vegetables, whole grains, lean proteins, and dairy, aligning with recommended dietary guidelines. For example, offering sliced apples with cheese instead of cookies provides sustained energy and essential nutrients. Prioritizing nutritious foods sets children up for healthy habits and supports their overall well-being. Question 18. A child care provider wants to foster children's self-help skills during snack time. Which of the following strategies is most effective? A. Preparing all snacks in advance and handing them out to each child. B. Allowing children to serve themselves appropriate portions with support as needed. C. Insisting children eat everything on their plate before leaving the table. D. Having children wait to be served by an adult for every item. Answer: B. Allowing children to serve themselves appropriate portions with support as needed. This question focuses on promoting self-help skills in young children, specifically during snack time, with the keyword most effective strategy. Encouraging self-serving, even with some adult assistance for younger children, empowers them to develop independence, fine motor skills, and an understanding of portion sizes. It gives children a sense of control and responsibility, which boosts their confidence. For example, providing child-sized tongs for serving fruit or a small pitcher for pouring water allows children to practice these skills. Offering choices and opportunities for self-service builds valuable life skills. Question 19. What is the main reason for engaging families in the child care program through various activities and communication? A. To reduce the amount of time children spend at home. B. To shift responsibility for child guidance entirely to parents. C. To create a strong homeschool connection that supports the child's holistic development. D. To encourage families to volunteer for all program fundraising events. Answer: C. To create a strong homeschool connection that supports the child's holistic development. This question emphasizes the crucial role of family engagement in early childhood programs, focusing on the main reason. When families and child care providers work together as partners, sharing information and consistent approaches, children benefit significantly. A strong homeschool connection ensures that the child's learning and development are supported across both environments, creating a cohesive and enriching experience that promotes their overall well-being. For example, when a family shares cultural traditions with the program, it enriches the child's sense of belonging and expands other children's understanding of diversity. Effective family partnerships are foundational to comprehensive child development. Question 20. Which of the following is an example of an open-ended question that encourages higher-order thinking in preschoolers? A. What color is this block? B. How many toys are in the basket? C. What do you think will happen if we add more water to the sand? D. Is your name John? Answer: C. What do you think will happen if we add more water to the sand? This question assesses the ability to use questioning techniques that promote cognitive development, specifically open-ended questions that encourage higher-order thinking. Open-ended questions do not have a single right or wrong answer and invite children to think critically, hypothesize, explain, or elaborate, which stimulates deeper cognitive processes. Questions about color, quantity, or simple yes/no questions are closed-ended and primarily test recall. Asking "What do you think will happen if we add more water to the sand?" encourages prediction, experimentation, and observation, which are complex thinking skills. Using open-ended questions regularly helps children develop critical thinking and problem-solving abilities. Question 21. What is the primary purpose of a written incident report in a child care setting? A. To assign blame for an accident or injury. B. To document an unusual event or injury, communicate with parents, and inform future safety practices. C. To determine which child should be expelled from the program. D. To serve as a formal warning for a staff member's negligence. Answer: B. To document an unusual event or injury, communicate with parents, and inform future safety practices. This question addresses the critical role of incident reports in health and safety, focusing on their primary purpose. An incident report is a factual, objective document that details an injury, accident, or other unusual event involving a child or staff member. Its purpose is not to assign blame but to accurately record what happened, notify parents promptly, and provide data that can be used to analyze trends, identify hazards, and improve safety procedures to prevent similar occurrences in the future. For example, if a child falls and scrapes their knee, the report details the time, location, nature of injury, and actions taken, which is then shared with parents. Comprehensive incident reporting is a key component of a safe and accountable program. Question 22. A child care provider observes a 1-year-old child repeatedly dropping a toy from their high chair and looking to see where it lands. According to Piaget, what concept is the child exploring? A. Object permanence. B. Conservation. C. Egocentrism. D. Seriation. Answer: A. Object permanence. This question tests understanding of key developmental concepts from Piaget's theory, specifically object permanence. Object permanence is the understanding that objects continue to exist even when they cannot be seen, heard, or touched. A 1-year-old repeatedly dropping a toy to see it reappear, or be retrieved, is actively testing this concept. They are learning that the toy still exists even when out of sight. For example, playing peekaboo also helps infants develop object permanence, as they learn that the hidden face will reappear. This exploratory behavior is a classic sign of cognitive development in the sensoromotor stage. Question 23. What is the most appropriate way for a CDA professional to address cultural diversity within the child care program? A. Celebrate only major holidays recognized by the majority culture. B. Ignore cultural differences to treat all children exactly the same. C. Incorporate diverse cultural traditions, languages, and family structures into daily activities and materials. D. Expect families to adapt completely to the program's cultural norms. Answer: C. Incorporate diverse cultural traditions, languages, and family structures into daily activities and materials. This question addresses cultural competence and diversity in child care, focusing on the most appropriate way. A culturally responsive program values and integrates the unique backgrounds of all children and families. This means proactively including multicultural books, music, dramatic play props, and discussions about different family traditions and languages into the daily routine. For example, if a child's family celebrates Diwali, incorporating a simple Diwali craft or story helps the child feel seen and valued, and teaches other children about different cultures. Embracing diversity enriches the learning environment for everyone and fosters a sense of belonging. Question 24. A child care program needs to establish clear rules for children's behavior. What characteristics should these rules primarily have to be effective for young children? A. Long, detailed, and comprehensive. B. Punitive and focused on what not to do. C. Few in number, positively stated, and easy to understand. D. Created solely by the adults without child input. Answer: C. Few in number, positively stated, and easy to understand. This question focuses on effective behavior management strategies, specifically the characteristics of good rules for young children. For rules to be effective, children need to understand them and remember them. Keeping rules few, stating them positively, e.g., walking feet instead of don't run, and using simple, clear language helps children internalize expectations. For example, instead of a long list, a program might have just 3 core rules: use walking feet, gentle hands, and kind words. This clarity helps children consistently meet expectations and contributes to a positive and predictable environment. Question 25. Which of the following is the most effective method for a child care provider to manage their own stress and prevent burnout? A. Suppress feelings of stress and work longer hours. B. Regularly engage in self-care activities, seek professional development, and utilize peer support. C. Isolate themselves from colleagues and avoid discussing work challenges. D. Focus solely on the needs of the children and neglect personal well-being. Answer: B. Regularly engage in self-care activities, seek professional development, and utilize peer support. This question addresses professional development and self-care for CDA professionals, emphasizing most effective method for stress management and burnout prevention. The child care profession can be demanding, so it's vital for providers to prioritize their own well-being. Engaging in activities that reduce stress, continuing to learn and grow professionally, and building a supportive network of colleagues helps maintain enthusiasm and effectiveness in the role. For example, taking a walk during a break, attending a workshop on positive guidance, or sharing challenges and successes with a trusted colleague can significantly reduce stress. Prioritizing self-care ensures providers remain capable and energized to best support children and families. Question 26. When conducting an emergency evacuation drill, what is the most important instruction for children to follow? A. Gather their personal belongings before leaving the building. B. Remain silent and hide under tables. C. Follow the teacher's instructions calmly and quickly to the designated safe area. D. Run as fast as they can out of the building. Answer: C. Follow the teacher's instructions calmly and quickly to the designated safe area. This question addresses emergency preparedness and safety procedures, focusing on the most important instruction during an evacuation drill. In any emergency, rapid and orderly movement to a designated safe location is paramount for everyone's safety. Children need to understand that their primary role is to listen to and follow the adult in charge, rather than trying to retrieve items or acting impulsively. For example, during a fire drill, practicing walking calmly in a line and immediately going to the designated meeting spot outside ensures that everyone is accounted for and safe. Clear, consistent practice helps children respond appropriately during a real emergency. Question 27. A child care provider observes a 3-year-old engaging in parallel play. Which of the following best describes this type of play? A. Children playing together, sharing toys and interacting cooperatively. B. Children playing alone with no awareness of others around them. C. Children playing side by side with similar toys but without direct interaction. D. Children observing others playing but not participating themselves. Answer: C. Children playing side by side with similar toys but without direct interaction. This question tests knowledge of different types of social play, specifically parallel play. Parallel play is a common and healthy stage of social development, typically seen in toddlers and young preschoolers, where children play independently but in close proximity to others, often using similar toys or materials. They are aware of each other but are not yet fully engaged in cooperative play. For example, two children might be building separate block towers next to each other, occasionally glancing at each other but not sharing blocks or coordinating their building efforts. This stage is a stepping stone towards more interactive forms of social play. Question 28. What is the primary purpose of a daily schedule in a child care program? A. To fill every minute of the day with structured, adult-led activities. B. To provide predictability and security for children while ensuring all developmental domains are addressed. C. To allow staff to take frequent, unscheduled breaks. D. To strictly enforce nap times and meal times without flexibility. Answer: B. To provide predictability and security for children while ensuring all developmental domains are addressed. This question addresses the fundamental role of a daily schedule in early childhood programs, focusing on its primary purpose. A well-planned daily schedule offers a consistent routine that provides young children with a sense of security and predictability, reducing anxiety and behavioral challenges. It also ensures that the program balances various types of activities, active and quiet, indoor and outdoor, individual and group, to support holistic development across all domains. For example, knowing that circle time always follows free play helps children transition more smoothly and feel safe in their environment. A predictable routine fosters a calm and productive learning atmosphere. Question 29. A child care provider needs to set up a safe sleep environment for infants. Which of the following is the most important guideline to follow? A. Place infants to sleep on their stomachs with soft bedding and toys. B. Place infants to sleep on their backs in a crib with a firm mattress and no loose bedding. C. Allow infants to sleep in car seats or swings for extended periods. D. Share a bed with infants to promote bonding and comfort. Answer: B. Place infants to sleep on their backs in a crib with a firm mattress and no loose bedding. This question addresses critical safe sleep practices for infants, emphasizing the most important guideline. The Back to Sleep campaign, Now Safe to Sleep, is a vital public health initiative recommending that infants be placed on their backs for every sleep to reduce the risk of sudden infant death syndrome, SIDS. Additionally, the sleep environment should be free of loose blankets, pillows, bumper pads, or toys, and the mattress should be firm, to prevent suffocation or strangulation hazards. For example, a baby should always be placed in a crib with only a fitted sheet, dressed in a sleep sack if needed for warmth. Adhering to these guidelines is paramount for infant safety. Question 30. Which of the following is the most effective way for a CDA professional to support a child's emerging literacy skills? A. Giving children worksheets to practice writing letters repeatedly. B. Providing a print-rich environment, reading aloud daily, and encouraging storytelling. C. Limiting access to books to prevent damage. D. Focusing solely on phonics drills from a young age. Answer: B. Providing a print-rich environment, reading aloud daily, and encouraging storytelling. This question focuses on effective strategies for fostering emerging literacy in young children, with most effective way. Early literacy development is not about formal instruction but about creating an engaging environment where children are exposed to print and language in meaningful ways. A print-rich environment includes labels, charts, and diverse books. Reading aloud builds vocabulary, comprehension, and a love for books, and encouraging storytelling promotes narrative skills and creativity. For example, a teacher might read a story, then invite children to create their own ending or draw a picture about their favorite part. These integrated experiences lay a strong foundation for future reading and writing success. Question 31. What is the primary benefit of outdoor play for preschoolers? A. It primarily serves as a time for quiet, solitary activities. B. It offers opportunities for gross motor development, exploration, and sensory experiences. C. It is mainly for adults to socialize while children are supervised. D. It reduces the need for indoor activity planning. Answer: B. It offers opportunities for gross motor development, exploration, and sensory experiences. This question emphasizes the primary benefit of outdoor play for preschoolers. Outdoor environments provide unparalleled opportunities for children to engage in vigorous physical activity, essential for developing gross motor skills like running, jumping, and climbing. It also allows for direct sensory experiences with nature, dirt, water, leaves, and fosters curiosity, exploration, and problem-solving in a less structured setting. For example, playing on a climbing structure develops balance and coordination, while exploring a garden encourages scientific observation. Outdoor play is crucial for children's physical health, cognitive growth, and connection with the natural world. Question 32. A CDA professional is observing a child who is struggling to express their feelings verbally and frequently resorts to hitting when frustrated. What is the most appropriate long-term strategy to help this child? A. Isolate the child every time they hit to prevent further incidents. B. Teach the child alternative ways to express feelings, such as using words or a feeling chart. C. Tell the child that hitting is bad and they will be punished. D. Assign the child a buddy to constantly monitor their behavior. Answer: B. Teach the child alternative ways to express feelings, such as using words or a feeling chart. This question addresses proactive guidance for challenging behaviors rooted in emotional regulation, focusing on the most appropriate long-term strategy. When a child hits out of frustration, it often indicates a lack of verbal communication or emotional coping skills. The long-term solution is to teach and model appropriate ways to express those strong feelings. This might involve using simple words like "I'm mad" or "I need a turn," or using visual aids like a feeling chart to help identify emotions. For example, a provider could say, "It looks like you're feeling frustrated right now. Can you use your words to tell me what you need?" This approach equips children with essential social-emotional tools. Question 33. What is the most important reason for a child care provider to engage in ongoing professional development and training? A. To receive a higher salary and faster promotions. B. To fulfill a legal requirement without genuine interest. C. To stay current with best practices, enhance skills, and improve the quality of care for children. D. To prove superior knowledge compared to other caregivers. Answer: C. To stay current with best practices, enhance skills, and improve the quality of care for children. This question highlights the significance of professional development for CDA professionals, emphasizing the most important reason. The field of early childhood education is constantly evolving with new research and best practices. Ongoing training ensures that providers remain knowledgeable about child development, health and safety regulations, effective teaching strategies, and family engagement techniques. This commitment to continuous learning directly translates into higher quality care and better outcomes for the children and families served. For example, attending a workshop on inclusive practices helps a provider better support children with special needs. Professional development is a cornerstone of effective and high-quality early childhood practice. Question 34. A child care program is implementing a new policy for parent communication. Which of the following communication methods is generally considered most effective for building strong family partnerships? A. Sending home weekly newsletters that require no response. B. Relying solely on formal parent-teacher conferences twice a year. C. Utilizing a variety of open, two-way communication methods, including daily informal chats, notes, and planned meetings. D. Communicating only when there is a problem or concern about the child. Answer: C. Utilizing a variety of open, two-way communication methods, including daily informal chats, notes, and planned meetings. This question focuses on effective parent communication, particularly for building strong family partnerships, with the keyword most effective. Strong partnerships require regular, varied, and reciprocal communication where information flows both ways. Daily informal chats at drop-off/pickup, quick notes, and scheduled conferences all contribute to a comprehensive communication strategy that keeps families informed and allows them to share insights about their child. For example, a quick comment about a child's joyful discovery during playtime at pickup builds a positive connection, while a planned meeting can address developmental progress. Consistent and diverse communication fosters trust and collaboration. Question 35. What is the recommended strategy for introducing new foods to toddlers in a child care setting? A. Force children to eat new foods by refusing to offer alternatives. B. Introduce several new foods at once to expand their palate quickly. C. Offer small portions of new foods alongside familiar favorites, allowing children to explore without pressure. D. Only offer new foods during special events and celebrations. Answer: C. Offer small portions of new foods alongside familiar favorites, allowing children to explore without pressure. This question addresses healthy eating practices for toddlers, specifically introducing new foods. Toddlers often have strong preferences and may be hesitant to try unfamiliar items, a common developmental stage. The most effective approach is to offer new foods in a non-pressured way, alongside foods they already enjoy. This exposure, over time, helps children become more comfortable with new tastes and textures without creating mealtime battles. For example, offering a small bite of steamed broccoli next to their favorite pasta allows them to touch, smell, and perhaps taste the new vegetable without feeling forced. Patience and repeated, gentle exposure are key to developing healthy eating habits. Question 36. According to Erik Erikson's Stages of Psychosocial Development, what primary challenge do toddlers, ages 1 to 3, face? A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. D. Industry versus inferiority. Answer: B. Autonomy versus shame and doubt. This question tests knowledge of Erik Erikson's theory of psychosocial development, focusing on the primary challenge for toddlers, ages 1 to 3. During this stage, children are developing a sense of independence and control over their own actions and bodies, often asserting no, and wanting to do things by myself. Successful navigation of this stage leads to a sense of autonomy, while excessive criticism or control can lead to feelings of shame and doubt. For example, allowing a toddler to choose their own snack or dress themselves, even if they need help, supports their developing autonomy. Supporting their desire for independence fosters self-confidence and self-control. Question 37. When arranging a classroom for preschoolers, what is the primary consideration for safety? A. Placing all toys in one large, unorganized bin. B. Ensuring clear pathways, visible exits, and safe storage of hazardous materials. C. Covering all windows to prevent distractions. D. Filling every available space with furniture to maximize play areas. Answer: B. Ensuring clear pathways, visible exits, and safe storage of hazardous materials. This question addresses environmental safety in a preschool classroom, focusing on the primary consideration. A safe classroom environment is fundamental. Clear pathways prevent trips and falls, visible and accessible exits are crucial in emergencies, and hazardous materials, like cleaning supplies or medicines, must be locked away out of children's reach. For example, arranging furniture so that children can move freely without bumping into obstacles, and clearly marking emergency exits, are essential safety measures. Prioritizing safety in arrangement and storage protects children from injury. Question 38. What is the primary role of play in early childhood development? A. To occupy children while adults are busy. B. To provide a natural and essential vehicle for learning across all developmental domains. C. To strictly develop academic skills like reading and math. D. To encourage competitive behaviors among peers. Answer: B. To provide a natural and essential vehicle for learning across all developmental domains. This question highlights the primary role of play in early childhood development. Play is not merely entertainment, it is the fundamental way young children learn and develop across all areas: cognitive, social, emotional, and physical. Through play, children explore, experiment, solve problems, practice social skills, express emotions, and build knowledge. For example, building a tower with blocks develops fine motor skills, spatial reasoning, and problem-solving, all through play. Recognizing play as a powerful learning tool is central to quality early childhood education. Question 39. What is the most effective strategy for managing transitions between activities for a group of 2-year-olds? A. Announce the transition abruptly and expect immediate compliance. B. Use consistent verbal cues, songs, or visual timers to give children a warning. C. Transition children individually to avoid group chaos. D. Allow children to continue their current activity until they decide to stop. Answer: B. Use consistent verbal cues, songs, or visual timers to give children a warning. This question focuses on effective transition strategies, specifically for 2-year-olds, who thrive on predictability. Providing advance notice helps young children mentally prepare for a change in activity, reducing anxiety and resistance. Consistent cues, like a 2-minute warning, a specific cleanup song, or a visual timer, help children anticipate what's next and develop independence in moving from one task to another. For example, singing a "time to clean up" song before moving to snack time helps toddlers know what to expect and participate. Predictable and signaled transitions create a calmer and more cooperative environment. Question 40. A child care provider is concerned about a child's speech development, as the 4-year-old rarely speaks and uses very few words. What is the most appropriate first step for the provider? A. Begin intensive speech therapy sessions within the classroom. B. Refer the child directly to a medical specialist without parental consultation. C. Document specific observations and discuss concerns with the parents, suggesting a developmental screening or evaluation. D. Assume the child is just shy and will grow out of it naturally. Answer: C. Document specific observations and discuss concerns with the parents, suggesting a developmental screening or evaluation. This question addresses early intervention for speech development concerns, emphasizing the most appropriate first step. As with any developmental concern, the first and most crucial step for a provider is to meticulously document observations of the child's communication patterns, or lack thereof, and then share these specific observations respectfully with the parents. The provider's role is not to diagnose or provide therapy, but to partner with families and recommend professional evaluation, as early intervention is key for speech delays. For example, a provider might say, "I've noticed Sarah rarely speaks during group time and uses mostly gestures to communicate. I wanted to share my observations and suggest we talk about resources for a speech and language screening." This collaborative approach empowers families to seek the necessary support. Question 41. What is the primary reason for encouraging young children to help with classroom chores, such as putting away toys or setting the table? A. To reduce the workload for the child care staff. B. To teach children responsibility, self-help skills, and a sense of belonging to the community. C. To prepare children for formal academic tasks in kindergarten. D. To determine which children are capable of following directions. Answer: B. To teach children responsibility, self-help skills, and a sense of belonging to the community. This question focuses on the developmental benefits of involving children in classroom chores, emphasizing the primary reason. Engaging children in daily tasks, like putting away blocks or helping set snack, goes beyond simply reducing staff workload. It instills a sense of responsibility, fosters independence, develops self-help and fine motor skills, and makes children feel like valued, contributing members of their classroom community. For example, a child who helps wipe down the table after snack feels a sense of accomplishment and learns to care for their environment. Providing opportunities for meaningful contribution builds confidence and teamwork. Question 42. What is the primary purpose of positive reinforcement in child guidance? A. To punish undesirable behaviors quickly and effectively. B. To encourage and strengthen desired behaviors by providing a reward or positive consequence. C. To make children dependent on external rewards for good behavior. D. To control children's actions through fear of negative outcomes. Answer: B. To encourage and strengthen desired behaviors by providing a reward or positive consequence. This question addresses a core concept in child guidance, positive reinforcement, focusing on its primary purpose. Positive reinforcement involves adding something desirable to the environment after a child demonstrates a desired behavior, increasing the likelihood that the behavior will occur again. It's about building on strengths and teaching appropriate actions. For example, if a child shares a toy, a provider might say, "Thank you for sharing, that was very kind," or offer a high five. This immediate positive feedback makes the child feel good about their action and encourages them to repeat it. Positive reinforcement is a powerful tool for shaping pro-social behaviors. Question 43. When planning activities for a group of mixed-age preschoolers, 3 to 5 years old, what is the most important consideration for effective learning? A. Providing only activities that challenge the oldest children. B. Offering differentiated activities that can be adapted to various developmental levels and interests. C. Separating children by age for all activities to ensure consistency. D. Limiting activities to only those that require minimal preparation. Answer: B. Offering differentiated activities that can be adapted to various developmental levels and interests. This question focuses on curriculum planning for mixed-age groups, emphasizing the most important consideration. In a mixed-age setting, children will naturally have different developmental abilities, interests, and prior knowledge. Effective learning occurs when activities are designed to be flexible and open-ended, allowing children of different ages and skill levels to engage meaningfully at their own pace. For example, a block area can appeal to a 3-year-old stacking simple towers and a 5-year-old building an elaborate structure with arches. Differentiated activities ensure that all children are challenged and supported appropriately. Question 44. What is the role of a CDA professional in fostering a sense of community and belonging among children in the classroom? A. To ensure children always work independently on tasks. B. To create opportunities for cooperative play, shared decision-making, and mutual respect. C. To enforce strict silence during all group activities. D. To encourage competition among children for rewards. Answer: B. To create opportunities for cooperative play, shared decision-making, and mutual respect. This question focuses on the CDA professional's role in building classroom community, emphasizing fostering a sense of community and belonging. A strong classroom community helps children feel secure, valued, and connected to their peers and adults. Providers can foster this by designing activities that require cooperation, like building a group fort, involving children in simple decisions, e.g., what song should we sing next, and modeling and promoting respectful interactions. For example, encouraging children to help a peer who is struggling with a puzzle builds empathy and teamwork. Creating a supportive and inclusive environment where every child feels they belong is fundamental to their social-emotional well-being. Question 45. What is the most crucial step for a CDA professional to take when a child experiences a minor injury, such as a scrape or small bump? A. Immediately contact emergency services regardless of severity. B. Clean the injury, apply first aid, comfort the child, and then inform the parents. C. Wait until the end of the day to inform the parents to avoid disruption. D. Ignore minor injuries as children often recover quickly. Answer: B. Clean the injury, apply first aid, comfort the child, and then inform the parents. This question addresses immediate response to minor injuries in a child care setting, focusing on the most crucial step. While serious injuries warrant emergency services, minor ones require immediate first aid and comforting the child to reduce their distress. Crucially, parents must be informed promptly about any injury, even minor ones, to ensure transparency and their awareness of their child's well-being. For example, if a child scrapes their knee, the provider should clean it with soap and water, apply a bandage, reassure the child, and then notify the parents at pickup or by phone depending on program policy. Timely care and communication are essential for child safety and family trust. Question 46. What is the primary purpose of a portfolio for a CDA candidate? A. To replace all formal coursework and exams for certification. B. To demonstrate competence in the CDA competency standards through collected evidence and reflections. C. To showcase personal artistic talents and creative hobbies. D. To serve as a resume for future job applications. Answer: B. To demonstrate competence in the CDA competency standards through collected evidence and reflections. This question clarifies the primary purpose of the CDA portfolio, which is a core component of the certification process. The portfolio is a collection of documents, observations, and reflective statements compiled by the candidate to demonstrate their knowledge, skills, and professional practices across all CDA competency standards. It's evidence that the candidate meets the professional requirements for working with young children. For example, it might include lesson plans, observations of children, and reflections on family communication. The portfolio serves as a comprehensive self-assessment and presentation of professional growth and competence. Question 47. When responding to a child's challenging behavior, what does consistency mean for a CDA professional? A. Changing responses frequently to keep children guessing. B. Applying the same rules and consequences predictably each time the behavior occurs. C. Ignoring some challenging behaviors while addressing others. D. Allowing different staff members to use different rules for the same behavior. Answer: B. Applying the same rules and consequences predictably each time the behavior occurs. This question focuses on a key principle of effective child guidance: consistency. For children to learn expected behaviors and understand consequences, adults must respond predictably to their actions. When rules and consequences are applied consistently, children learn what to expect, which helps them feel secure and understand behavioral boundaries. For example, if the rule is walking feet inside, then every time a child runs, the provider should calmly remind them to use walking feet, regardless of who is supervising. Consistency builds trust and predictability, making the learning environment safer and more effective for behavior management. Question 48. A child development associate is designing a new art activity for a group of 4-year-olds. To best support their creative expression, which of the following materials should be prioritized? A. Pre-cut shapes and specific instructions for a craft project. B. A limited selection of crayons and coloring books. C. A variety of open-ended materials like paint, clay, collage items, and large paper. D. Digital art programs on tablets with preset templates. Answer: C. A variety of open-ended materials like paint, clay, collage items, and large paper. This question addresses fostering creative expression in preschoolers through art activities, focusing on prioritizing open-ended materials. Unlike preset crafts or coloring books that limit imagination, open-ended materials allow children to explore, experiment, and create freely without a prescribed outcome. This fosters original thinking, problem-solving, and self-expression. For example, providing a variety of recycled materials, glue, and paint allows children to build anything they can imagine, from a robot to a fantastical creature, empowering their unique artistic vision. Offering diverse, adaptable materials truly supports genuine creativity. Question 49. What is the primary reason for a child care program to conduct regular fire drills and emergency preparedness drills? A. To scare children into understanding safety rules. B. To comply with regulations without children needing to understand the purpose. C. To teach children and staff how to respond safely and efficiently in a real emergency. D. To determine which children are brave enough to lead the group. Answer: C. To teach children and staff how to respond safely and efficiently in a real emergency. This question addresses the purpose of emergency drills, emphasizing the primary reason. Regular practice of fire and other emergency drills is crucial for ensuring that both children and staff know exactly what to do and where to go in a real crisis. The goal is to build muscle memory and calm, orderly responses, rather than relying on spontaneous action during a stressful event. For example, practicing walking calmly to the designated meeting spot outside during a fire drill ensures that everyone is accounted for and safe if a real fire occurs. These drills are essential for maintaining a high level of safety and preparedness. Question 50. When introducing new vocabulary words to preschoolers, what is the most effective approach for a CDA professional? A. Presenting a list of new words for children to memorize and define. B. Integrating new words naturally into conversations, stories, and activities with visual aids or demonstrations. C. Using complex, abstract words to challenge their linguistic abilities. D. Correcting every pronunciation error immediately and repeatedly. Answer: B. Integrating new words naturally into conversations, stories, and activities with visual aids or demonstrations. This question focuses on effective language development strategies for preschoolers, highlighting the most effective approach for new vocabulary. Young children learn new words best when they are introduced in context, relevant to their experiences, and supported by visuals or actions. Simply memorizing lists is not effective for deep understanding. For example, when reading a book about animals, a provider might point to a picture of an enormous elephant and say, "Wow, look how enormous this elephant is." Enormous means very, very big. This makes the word meaningful and memorable. Natural, engaging exposure to rich vocabulary helps children build strong language skills.